Good morning, everyone. My name is Paul. I'm just going to walk you through healthcare and education for Canada. I'm going to look at some examples, but I'm going to kind of give you a holistic view of the impact from government funding all the way down to the student level and how it impacts. So my presentation is going to be one perspective, healthcare and education. You're more than apt to go read annual reports from school boards or even healthcare from hospitals or other organizations to get their perspective. Just a little bit about myself. I'm a CPA, CGA by trade, so I kind of look at everything from all angles of policy. So this particular case, my focus is going to be basically on policy. I'll talk about what CHT is, I'll talk about the transfers, I'll talk about funding healthcare with an example, I'll talk about education, I'll talk about teachers' compensation, and I'll talk about funding education with an example as well. Now, what the government of Canada does is part of equalization of money. They take a bucket of income from taxation and then they reallocate it out in terms of supporting government programs for healthcare. So CHT is a Canadian healthcare transfer that's basically growing at 6% up to 2016-2017. There's a new accord out there. It hasn't been signed yet, and it basically caps it at 3% in terms of the growth. It will be no less than 3%, but it could grow more depending on the economy. Just gives you an example of the transfers for Canada in terms of how much is transferred in terms of 2016 to 2017. So it's about $71 billion is transferred. Now let's look at an example of the Canadian healthcare transfer. So the federal government gives about almost $14 billion of fund money to the provinces. Okay, in this particular case, Ontario spends about $52 billion annually on healthcare. Now healthcare is the single most biggest expenditure for a province. So what I wanted to show you here is they're only ponying up 2% of that funding, yet they're getting 6% from the federal government. So where's the other 4% going? Nobody ever discussed the gap there and should be asking that question in terms of the funding. Second point is hospitals are mandated they cannot run deficits, so they have to be able to keep their money in check. So a lot of cases what happens is they reduce funding down and their operating costs are growing faster, then they're forced to do cuts. I've used Royal Victoria as an example here, is as they're going through their annual reporting review, gap analysis, they've been forced to cut jobs. Those are frontline staff. So if you reduce frontline staff, you're really reducing down the ability of service levels to service the patient. Now that will impact frontline services. So despite what you hear from the provincial government, they say they can increase funding, but what they've done is they've forced healthcare cuts down to the hospital level. This shows you healthcare ranking across Canada, and you'll see here particularly where some of the provinces are ranked. Now it's a misnomer just to look at ranking, but it gives you an idea of two things: is how we're managing healthcare, but it doesn't show you how we're getting valued for money. So that's the thing that needs to be come into play here as well. Let's talk about education quickly. Now, this is based on 2013, so it's a little bit dated. However, you're seeing significant amount of money spent across Canada, and if you look at like provinces like Alberta, BC, they all pay significant amount for education. This is a good example to show you the income level. Teachers are paid relatively well. I'm not discounting their ability to teach, but their incomes are, when you look at on average compared to average salaries, they've actually done quite well. Now, some of the issues that come into play is also the pension funding issue that's in here too as well. So teacher salaries is the biggest portion of educational budgets. So let's look at education itself. School boards also too cannot run deficits. So what ends up happening here is they get funding, and that funding then is based on a per pupil level. Now that funding is required as part of the overall funding, in that they get other sources of revenue, but the bulk of their expenses are teacher compensation. So if you don't get control of teacher salaries, what's going to end up happening, you're going to have a cost multiplier that's going to impact your ability to deliver but manage your costs. So there is pressures on school boards to keep people down at a low end of the chart longer in terms of the grid, but it isn't dealing with the systemic issues on compensation overall, from pension funding to benefits, that likely will impact school boards, because we've got to keep control of costs. The other thing that's coming into play, we have declining enrollment, and that's where ARC comes in, where we do school closures. So there's a likelihood of seeing less teachers become in the circulation become a problem. Some of the issues you'll see across Canada with education in general is you're seeing a lot less. It's harder for young teachers to get in because of some of the systemic issues where some of the people that retire come back into the system and do supply teaching, so that takes those people out of it. So that's a whole thing that's happening across Canada in terms of education. The other thing with education too is the system itself is not promoting people to go into proper careers, and that's what leads you into this last slide. This shows you kind of the role, a little bit more details on the spending side, but it also gives you an idea on career management and employment outlook. Students are getting pushed into going into careers done university level, but the economy itself is only so big. That's something that needs to be discussed in general as you take a holistic view of education. It's kind of giving you an idea to say what is required as you move forward with an economy, but it needs to be aligned with opportunities. And I'm not sure the school systems are doing a strong enough view of pushing people to careers where there's opportunities. Now back and leave the final on healthcare. Healthcare needs to be looked at in a value for money concept. We've had too much money where you hear money thrown at the symptoms. That doesn't fix the root cause. That's another thing that needs to be bear in mind when you frame it, when you're looking at the two areas, because education and healthcare are significant expenditures that are going to have issues on sustainability when they come to cost controls. Thank you.